Hello, my dear friend. I'm truly glad we've met again here in this familiar space dedicated to the health and well being of older adults. I'm not speaking to you as a doctor on a pedestal, but as someone you can trust, a friend who sincerely wants to share useful knowledge that can help you take care of your body in a proactive and safe way. Have you ever heard of a story like this? A relative or neighbor, someone you were just talking and laughing with the day before, suddenly passes away during the night. The cause? A stroke. Maybe it sounds distant and unlikely until it happens to someone close, because according to national medical statistics, nearly half of all strokes occur at night, while we're asleep. And the most dangerous part isn't how quickly a stroke strikes, but how silently it does. No cry for help, no obvious warning signs. Sometimes even the people nearby don't notice what's happening. I still remember a case from our own neighborhood. A kind elderly gentleman in his 70s, full of life, seemed healthy as ever. But one early morning, his family heard a strange noise. When they checked, they found him collapsed on the floor. His mouth was crooked, and one side of his body was completely paralyzed. Fortunately, his daughter-in-law, who happened to be someone who watched health programs regularly, had once learned how to respond to a stroke. She didn't panic. She calmly followed a few simple emergency steps, the same ones I've shared before, and by the time the ambulance arrived, the man was already showing signs of response. The doctors later said that if help had come even 10 or 15 minutes later, it might have been too late. That story left a deep impression on me, because not everyone is so lucky. Many people lose their lives quietly in the night simply because they don't know how to react, or because they ignored the early signals their body was giving them. My dear friend, stroke, especially nighttime stroke, is a hidden danger. It can affect anyone, and older adults are especially vulnerable. But here's the good news. If we prepare in advance, learn to recognize the symptoms, and master just a few simple techniques for self-rescue, we can greatly reduce the risks and even save our own lives. In today's video, I want to explain a few very specific and easy-to-remember techniques that can give you the confidence to protect yourself even in the most urgent moments. Please stay with me for just a few minutes, because sometimes one timely movement can change the course of an entire life. How dangerous is a nighttime stroke? At night, when darkness falls, the body enters a state of deep rest. Heart rate slows, blood pressure drops, and all our biological processes settle into a calm rhythm to allow the body to recover and heal. But during these peaceful hours lies an invisible threat. A stroke occurs when there is a sudden interruption of blood flow to the brain, either due to a clot or a ruptured vessel. And what's truly alarming is that a large number of strokes happen at night or in the early hours of the morning. While we're asleep and completely unaware, our bodies are at their most vulnerable. According to recent medical research, nearly 50% of stroke cases occur during sleep, especially among older individuals. As we age, our blood vessels, heart, blood pressure, and immune systems undergo significant changes. For those with high blood pressure, arteriosclerosis, heart conditions, or diabetes, nighttime circulation slows even further, increasing the risk of clotting, blockages, or vessel rupture. And the saddest part? Many people wake up feeling tired, with numbness in their limbs, a strange headache, slurred speech, or an unsteady gait. But they assume it's just poor sleep or fatigue. They ignore the body's subtle warning signs, and by the time the symptoms become undeniable, it may already be too late for optimal intervention. You need to be especially aware of the following signs that may appear upon waking. They could be urgent warnings of a stroke, a crooked mouth or drooping face, weakness or numbness in one arm or leg, difficulty speaking clearly, severe dizziness or imbalance, a sudden, intense headache, confusion, or even loss of consciousness. These aren't random occurrences, they're alarm bells from your body, and they demand immediate action. I understand. You might be thinking, what if I'm alone at night and something like this happens? What can I do? But don't worry, I'm here to help you get prepared in advance. You absolutely can help yourself in those golden minutes if you know what to do. And what I'm about to show you doesn't require any medical equipment, no special tools, not even medication, just your hands, a calm mind, and a few simple, powerful techniques. In the next section, I'll walk you through them step by step because we can't prevent all sudden events in life, but we can prepare for them, and that makes all the difference. Acupressure techniques. How seconds can save a life. Dear friend, here's something reassuring. Even if a stroke strikes in the middle of the night and no one else is around, you still have a chance to act, thanks to a technique passed down for centuries in traditional medicine. This technique is called acupressure, and it has helped countless people gain precious time before medical help could arrive. It's simple, gentle, and it only requires your own hands and a bit of inner calm. The core idea behind acupressure is this: by stimulating certain points on the body, you can help unblock circulation, regulate blood flow, and increase oxygen supply to the brain. That, in turn, may allow your vital signs to stabilize, long enough to wait for help or even to begin recovery on your own. But the very first and most important step is this: stay calm, even if your speech is slurred or your body feels numb or weak. Even if you're dizzy, don't panic. Tell yourself, I need to act right now. Take a few deep breaths and begin. Here are the 3 key acupressure points you should remember and practice in advance. First, Renjong, philtrum point. Located between the base of your nose and the upper lip, this is a major emergency point often used to help restore consciousness. Using your thumb or index finger, press upward into the groove firmly, but not painfully. Hold for 5 to 10 seconds, then release. Repeat this motion a few times. If you're on the right spot, you may feel a slight tingling or tightness. Second Feng Qi, wind pool point. These points are on the back of your neck, on either side just below the base of the skull, in the hollows near the hairline. Use your thumbs to apply gentle circular pressure, clockwise or counterclockwise. The goal is comfort, not pain. Moderate pressure is ideal. This point helps relieve tension in the head and neck, promotes blood flow to the brain, and soothes the nervous system. 3. Heigu, joining valley point. Perhaps the easiest to find and use. This point is on the back of your hand, between the base of the thumb and index finger, in the fleshy webbing. Use your other thumb to press down and hold for a few seconds, then release. Repeat 10 to 15 times on each hand. This point helps improve overall circulation and can assist in restoring blood flow during an emergency. You don't need to press these points for long. 5 seconds to a minute each is enough. You can rotate between them or focus on the one that feels most responsive or soothing. You can also massage your temples, just behind the ends of your eyebrows, to relieve headaches and ease tension. I know it might seem difficult to remember all this during a crisis. That's why I strongly recommend practicing these steps regularly, even when you're healthy. Make it part of your morning or evening routine, like stretching or brushing your teeth, something your body memorizes so that when the moment comes, it reacts automatically. This is not superstition. This is a practical method born from centuries of traditional knowledge and now supported by many modern medical experts. Best of all, you don't need any tools, medication, or special training. Just your hands and a calm mind. A few seconds of this technique could give you the precious window of survival, the time you need until a loved one or emergency team can help. So now, what should you do after performing these emergency steps? Even if the symptoms seem to ease, remember, the danger isn't over. The way you respond in the following moments is just as critical. What to do after self-acupressure? The golden hour. The first 60 minutes after stroke symptoms appear is often called the golden hour, and every second counts. Whether you're helping yourself or someone else, here's what to do. If the person is still conscious, gently turn them on their side, with the head slightly elevated, about 30 degrees. This helps keep the airway open, especially if there's nausea or difficulty breathing. If you are the patient, try slowly turning to your side. Avoid standing or sitting up suddenly. This could rush blood to the brain and worsen the condition. If you're in a closed room, open a window or door immediately to let fresh air in. Increased oxygen supply is crucial. You can also gently massage the neck, shoulders, and back of the head using your fingertips in light, circular motions. The goal is relaxation, to reduce pressure on blood vessels and improve brain circulation. And most importantly, call emergency services immediately. When you call, describe the situation clearly. Facial drooping, limb numbness or paralysis, difficulty speaking. Mention that you performed basic acupressure and that you're waiting for help. If possible, note the time the symptoms first appeared. This is vital for doctors to determine the best treatment strategy. While waiting for the ambulance, if the person is still awake, comfort them, reassure them, encourage them to breathe deeply. Speak gently. I'm here. Everything will be okay. And if you're the one suffering, tell it to yourself, out loud. Calm thoughts and emotional stability can positively influence your body's response. And remember, acupressure is not a cure. It is a support tool meant to buy you time. True treatment must come from medical professionals with proper equipment. The sooner you reach the hospital, the better your chances of full recovery, and the lower the risk of lasting damage. Dear friend, if you stay calm and follow these steps carefully, you are already protecting your health and possibly your life. In the next part, I'll share a few expert-backed tips that can help you prevent strokes from the root through small daily habits that truly make a difference. 3 expert-recommended habits to prevent stroke at the root. Dear friend, we've all heard the saying, prevention is better than cure. And when it comes to stroke, this couldn't be more true. Even if you've already learned emergency techniques, how to apply acupressure, how to stay calm, how to act fast. If you're not taking daily care of your health, you're still walking a fine line. That's why I want to share with you 3 deeply valuable tips passed down by doctors and specialists. Simple actions that can significantly reduce your risk of suffering a stroke, especially at night. Habit 1. Make daily acupressure a gentle routine. Yes, not just in emergencies, every single day. Acupressure isn't only for crisis moments. Done regularly, it becomes a subtle way to energize the body and regulate your circulation. Think of it like morning stretches or brushing your teeth. You can focus on the points we've already discussed: the philtrum, renchong, the back of the neck, fengqi, and the hand valley, hegu. If you often get headaches, add the temples as well. Take just 5 minutes every morning or evening. Over time, your body will respond better to the stimulation, and your circulation will improve. Blood will flow more smoothly, and your vessels will remain elastic. Dr. Ruan Mingda, a traditional medicine expert with over 35 years of experience, has observed that elderly patients who consistently practice acupressure reduce their stroke risk by 15 to 20%. I know an 80-year-old woman who used to suffer from insomnia and dizziness, but once she started massaging these key points every night, her symptoms began to fade. She told me with a laugh, "Just a few minutes of gentle massage, and my mind feels clear. I feel light and energized the whole day." Habit 2. Monitor your blood pressure regularly at home. High blood pressure is one of the leading causes of stroke, especially when it fluctuates during the night. Many seniors live with undiagnosed hypertension because the early stages often show no symptoms at all. If possible, buy an electronic blood pressure monitor. It's simple and easy to use. Measure your pressure at least twice a week, ideally at the same time each day. Write down the numbers and track them over time. One well-known cardiologist noted, "Keeping your blood pressure below 140 over 90 millimeters of mercury can reduce stroke risk by over 30%. I personally saw this in action. A retired man discovered he had hypertension and began adjusting his diet, taking his prescribed medications, and regularly monitoring his blood pressure. Within just 2 months, his health stabilized. The headaches he had every morning? Gone." Habit 3. Protect your emotional well-being, especially before bed. Yes, your mood matters. Long-term stress and anxiety can raise blood pressure, constrict your vessels, and increase the risk of nighttime stroke. Research shows that people who engage in relaxing habits before bed, like listening to calming music, reading, or meditating, not only sleep better, but also enjoy stronger cardiovascular health. I remember a widow who lived alone and suffered from restless nights. She often woke up anxious and couldn't fall back asleep. I suggested that she try listening to soft meditation music and practicing deep breathing before bed. After a few days, she told me, "Now I fall asleep peacefully. I don't wake up in the middle of the night anymore. I feel safe." That inner calm, that gentle peace, it's like a silent guardian watching over you while you sleep. Not only does it help you rest, but it strengthens your heart and mind. Dear friend, these 3 habits may seem simple, but if you practice them every day, you will start to feel the difference in your body, your thoughts, and your energy. Consider them a gift to yourself, a small gesture of care, of awareness, of love. And in the next section, we'll go over all these key points together. And I'll invite you to make a quiet but deeply meaningful personal promise. Protecting life with thoughtful preparation. Dear friend, by now, we've taken an important journey together, one that I hope has opened your heart and mind. We've explored the hidden risk of nighttime stroke. We've learned simple yet powerful emergency techniques. We've talked about daily habits that can truly change your health from the inside out. And I believe that with everything you've learned today, you've begun to build an invisible armor, one that may not stop danger from appearing, but can help you be ready when it does. We don't get to choose when emergencies happen, but we can choose to be prepared. We can train our hands, train our minds, so that when the moment comes, we don't freeze, we act. The technique of acupressure may take only a few seconds, but it can buy you priceless time. In many cases, those few seconds are the bridge between life and death. Remember the elderly man who survived thanks to his daughter-in-law's quick action. She wasn't a doctor, she was just prepared. She remembered what to do, and because of that, he lived. And there are so many more stories like his. People who spotted the signs early, acted without hesitation, and recovered. These are real-life examples of how knowledge plus preparation equals survival. So I invite you now to ask yourself a very simple question. If this happened to me tonight, would I be ready? If the answer isn't a confident yes, then this is your moment to memorize those points, to practice every day, not out of fear, but out of love. Love for your life, for your family, for yourself. I also recommend this. Write down the emergency number and place it beside your bed, or add it to your phone's speed dial, or ask a family member to show you how to call quickly in an emergency. This is not paranoia. This is care. Quiet, thoughtful, practical care. Your sleep isn't just rest. It's an opportunity, a sacred window, to protect the one thing no one else can, your life. Go to bed with warmth in your body, peace in your heart, and the knowledge that you are prepared. And now, at the end of our conversation, I'd like to invite you to make a quiet but powerful promise, just to yourself. If you've learned the acupressure techniques, if you've decided to make them a daily habit, then simply say these words in your mind: I am ready. No one needs to hear it, just you. That quiet affirmation is a turning point, a declaration of self-respect, of strength, of commitment to your future. And if you feel that today's message was helpful, I hope you'll keep it close to your heart. Sometimes sharing a kind word, a gentle reminder, a small gesture can be what saves someone else's life. By passing this knowledge on, you become a quiet source of peace and strength in your community. Thank you for staying with me until the very end. I hope these reflections and insights become a warm and practical part of your days ahead. May your life be healthier, may your heart be calmer, and may your days feel fuller, more present, and more meaningful. I wish you and your loved ones peace, safety, and many happy, healthy tomorrows. Until we meet again,